Top 20 Midwife Interview Questions and Answers. Who is a midwife? This is an individual who is responsible for the physical, mental, and emotional care of their patients during delivery. Below are the top 20 interview questions and answers you are likely to be asked. Also, there are sample answers that will guide you on how you are supposed to answer the questions. 1. Why are you interested in this role? 95% of interviewers will ask you this question to help them know why you need the post. Talk about putting your knowledge and skills into practice and learning from them. Sample answer. After I learned that you were recruiting, I had to apply for this post to put the knowledge and skills I have attained from my studies and experience into work. I would be delighted to see my skills and knowledge being used to help others. In addition, I have always wanted to help the mothers who are delivering, so that they can get the best services while they are giving birth. Working in this post will be an achievement for me since it is something that comes from my heart. It will be a great achievement to work for you and at the same time improve my skills and learn from you as well. Also, I would not hesitate to say that I want to get a job so that I can earn a living and help my family pay bills. 2. What are the roles of a midwife? The interviewer wants to know if you understand what your mandates as a midwife are. Mention your job description or draw from your previous experience. Remember, you are allowed to mention as many roles as you can. Sample answer. A midwife's job description revolves around helping pregnant mothers. They are mandated with examining and monitoring pregnant women, offering antenatal care in hospitals and homes, coming up with care plans after proper assessment, conducting screening tests, offering necessary information, reassurance, and emotional support to pregnant mothers and their partners, taking care of women in labor, writing records, administering medication, injections, and the necessary infusions during labor, advising parents on how to take care of their newborns, and taking necessary patient readings such as blood pressure, temperature, and pulses. They also mentor upcoming midwives, single out high-risk pregnancies, and help parents deal with traumatizing experiences such as miscarriage, stillbirth, termination, and neonatal death. 3. What are the qualities that a midwife needs to be successful? The interviewer wants to know what qualities and skills you have to possess to succeed in this role. Talk about the qualities that you think can make you succeed in this post. Sample answer. Besides having the academic qualifications in this post, I believe that it requires a candidate with certain qualities that will make the midwife work successfully. First, a midwife should be kind, respectful, and open. One should also have good communication skills since they will be involved in many communications with patients, facilities, family members, and other facility stakeholders. A midwife should also be friendly to patients and talk nicely to them. I believe those are my qualities, and I would love to use them in your facility. 4. What major challenges did you face during your last role? How did you manage them? The interviewer wants to know the difficulties you have come across in this industry. Talk about the challenges you have faced in your previous role and how you managed them. Sample answer. The first challenge that I faced in my previous role is the language barrier. Some patients might not understand the commonly used language, so it is important to look for an interpreter to advise accordingly. Secondly, as a midwife, you can come across patients who have an ego. They want to do what they think is right, but not what you are telling them. The best way to deal with this kind of patient is to educate them on the importance of following instructions given to them by their doctors. It can affect their health. 5. Describe your daily routine as a midwife. The interviewer wants to know what order you should follow while performing your duties. Give them a very organized schedule starting from the first activity till the last. Sample answer. Once I get to the office, I sanitize the area, get logged into my computer, and inform the supervisor that I am in. After that, I check on at least 3 postpartum clients. If there are patients that need to be released to go home, I take my time talking to them and making sure that they are healing properly. After taking my lunch, I get into the birth center where I answer calls and respond to mails from pregnant women who are inquiring about our services. This would be a repeated routine and call it a day. 6. Describe briefly about your experience. Here, the interviewer wants you to discuss where and how long you have worked as a midwife. Talk about where you have worked before and the number of years you have worked in this role. Sample answer. After completing my studies, I started gaining skills as an intern in a government maternity hospital. After working there as an intern for 1 year, I got a job in another private hospital as a midwife, where I worked for 2 years under a contract. I must say that I have gained a lot of experience working in this role. I want to use this experience to better your facility and continue sharpening my skills as well. It is my hope that you will consider my experience as an added advantage to me. 7. What kind of strategies and mindset is required for this role? The interviewer wants to know your attitudes towards this role and which strategies you can use to succeed. Talk about what attitudes a midwife should have. Sample answer. It is always good for a midwife to have a mindset of helping patients and pregnant women by making sure that they are comfortable with the midwife services or advice they are getting in the facility. A midwife should always focus on good customer service to the facility clients. They should always think of helping, besides it being income generating. Keep a good heart. That's the most important thing in this role. It is not about how much you earn. The heart of it is to keep a good heart. 8. What is the biggest challenge that you foresee in this role? When asked this question, talk about the big challenge that you think will affect this role in the future. Also, suggest possible solutions to the challenge if possible. Sample answer. As a midwife, I must admit that there is a big challenge when it comes to exchanging patients' information with other health facilities. Electronic health record, popularly known as EHR, is essential since it can help doctors know more about past patients' health issues and treatment. Some doctors may prefer using the ACO, making the EHR useless in this case. There should be collaboration and cooperation when exchanging this data with other health carers. 9. How do you stay motivated in your work? The interviewer wants to know what makes your morale high while working. It is essential to talk about achievements in your career as your biggest motivators. Sample answer. As a midwife, I am always motivated to continue working in this field when I see a lot of pregnant women giving birth in the right way and head home with their newborns accompanying them. I feel that this is a very big achievement that is worth celebrating. This is always my motivator and gives me motivation to continue working well. 10. Describe a time when you failed in this role and the lessons you learned. Your interviewer knows that you made a mistake and made you fail in your duties at some point. Talk about an event you felt you have failed and the lesson you learned from the incident. Sample answer. In my entry-level position at my previous job, a pregnant lady had some health issues with her pregnancy, and so she came to seek advice from us. And according to her condition, we had to advise her to give birth by C-section the following week. I wrote the surgery date for her, but little did I know that I needed to follow up on her and remind her about the C-section scheduled day. When most of these ladies come to the facility, they may be having a lot in their minds that they would forget when their next visit is supposed to be. She did not show up, and after contacting her, she had forgotten about it. I learned that it is essential to remind our patients of their scheduled next visits to avoid inconveniences. 11. Why do you feel you are the most suited for this role? The interviewer wants to know why you think you are the candidate they are looking for. Talk about unique qualifications and experiences that can make you secure the position. Sample answer. I have a bachelor's degree in midwifery. Having attained this degree, I have enough knowledge on maternity issues, which can be a real advantage to the facility and me. In addition, I have worked in this post for 3 years, and I think I have what it takes to be in this position. Having worked in this position before, I believe that I will have an easy time working. This is a post that requires an experienced person as well. 12. Share with us your greatest achievements. Your interviewer expects you to talk about the aims you have achieved in your career. Talk about the achievements, promotions, and awards that you have received in your career. Sample answer. In my previous role, I used to work with a lot of passion and ensured good and polite language while talking to patients. In that facility, a patient would rate you out of 5 according to the services you offered. At the end of the year, I had the most positive ratings and was awarded as the year's staff. This award came along with a certificate and a gold medal that I am proud of. I believe that I will use the same strategies in your facility. 13. Mention 6 types of baby ultrasounds that you know of. Here, the interviewer tests your academic knowledge, whether you know the type of ultrasounds that a midwife uses. Mention the 6 of them. Sample answer. As a midwife, there are several types of baby ultrasounds. Among the essential 6 are: A. Transvaginal scan. B. Standard baby ultrasounds. C. Advanced baby ultrasounds. D. Doppler ultrasounds. E. 3D baby ultrasounds. F. 4D baby ultrasounds. These are the top 6 types of ultrasounds that are offered by midwives. 14. Talk about the advantages of breastfeeding the baby. As a midwife, you will be expected to teach the mothers on the benefits of breastfeeding. Talk about the major benefits to the baby. Sample answer. There are several benefits of breastfeeding a baby after birth. These advantages to the baby are: fewer instances of allergies, eczema, and asthma. Fewer childhood cancers, including leukemia and lymphomas. Lower risk of type I and Crohn 2 diabetes. Fewer instances of Crohn's disease and colitis. Lower rates of respiratory illness. Fewer speech and orthodontic problems. These are the main benefits of breastfeeding a baby. 15. Mention 6 rights of a patient. As a midwife, you should be conversant with the patient's rights since they are crucial. Mention clearly 6 of them. Sample answer. When patients step their first foot on a healthcare facility, they have their rights. Among them are: A. Right to be treated with respect. B. Right to privacy of medical records. C. Right to obtain your medical records. D. Right to make a treatment choice. E. Right to make decisions about end-of-life care. F. Right to refuse treatment. The mentioned rights are very crucial and should be respected as they are. They should be well written where the patients can see them clearly. 16. What is a baby incubator? The interviewer wants to test your knowledge on the apparatus that are used by babies. Sample answer. An incubator is designed to provide a safe, controlled space for infants to live while their vital organs develop. 17. How would you advise a first-time mother on early signs and symptoms of labor? Your interviewer wants to know whether you know about the early symptoms of labor pains. Sample answer. Early signs and symptoms of labor include an increased urge to urinate. The mucus plug dilates. Back pain. A burst of energy. Diarrhea. 18. Tell us the most common types of birth that you know of. Your interviewer wants to know whether you know about common types of birth that you know of. Mention the main ones. Sample answer. The most common birth types are vaginal birth, natural birth, unplanned cesarean. Vaginal birth after C-section. 19. What should we expect from you in the first month working in our facility? The interviewer wants to know what you will offer them in the first month of working in their facility. Talk about learning, adapting, and testing your strategies in the first month. Sample answer. In my first month working in your facility, I will be mostly testing my strategies, learning from the facility as far as guidelines of duties are concerned, and adapting to the new system. In the same month, I will also be fixing my schedule to see how and when is the right time to perform a certain task. Lastly, expect maximum cooperation and quality work from me. 20. What would be your biggest fear in this role? The interviewer wants to know what you would not like to face in this role. You can talk about something that bores or puts you off in your career. Sample answer. I would say that producing poor results as a midwife would be my biggest fear. Whenever a patient rates you according to the service you offered, you expect them to be satisfied. I wouldn't want to get a 1-star rating due to poor service. That would be my biggest fear. That is why I work as expected to meet all the patient's expectations. This is a rating I have never received and would never like to receive from clients. Conclusion. A midwife needs to be a polite and kind person, so make sure you use polite language and a low tone when answering questions. Answer the questions with a lot of confidence and get straight to the point with few but clear explanations. The above guidelines will help you answer the questions and secure the job post. All the best.